We start with breaking news tonight at 10 o'clock. USA officials have just confirmed the woman who was brought to the hospital tonight has no risk of Ebola.
Yeah, she was originally transferred from the health department to USA complaining of Ebola-like symptoms, and a red flag certainly had health workers on alert. Her relatives recently spent time in Africa. Local 15's Derek Rose starts our team coverage tonight from the USA Medical Center.
Derek, you talked with USA officials just moments ago.
We did, Kim, at the bottom of our 9 o'clock newscast over on UTV 44. That information coming from Jen Ekman, the spokesperson for University of South Alabama Medical Center. As you mentioned, the patient that was brought here earlier this evening does not meet the standards for having Ebola. Let's bring Jen Ekman in right now just to give us some more details on exactly the procedures and the process you all had to go through this evening.
Sure. We followed our regular CDC procedures like we had practiced. And we are very pleased to report tonight that the patient was, after a thorough examination was conducted by both our emergency department doctors and our infectious disease specialist, the patient is determined that the patient does not meet the CDC requirements for the Ebola virus, so there is no risk for Ebola.
And we were hearing early on that the likelihood of this person having Ebola was very low. Can you kind of explain why that is?
Yes, there are several different things for the Ebola virus. As we've talked about over recent days, you have to have either traveled to an area that's had the virus and been in direct bodily fluids contact with someone who has had the virus while they're symptomatic. Then you have to be showing symptoms of the virus. So there are a lot of things that there are a lot of factors and there are a lot of signs of the virus before you go any further. And the patient was showing none of that.
And what is the next step for the hospital at this point? I know the patient is in isolation. Where do we go from here?
We're back to normal operations at the hospital, and we'll just move forward from there. And luckily, because there was no Ebola case tonight, we'll be able to use this as a model for moving forward.
And out here, it was a very big first responder presence, a lot of flashing lights, a lot of fire trucks, ambulances, police officers. For folks viewing at home that may think this is an overreaction to a case that turned out not to be Ebola, what is the response from hospital and health officials?
Well, what I would say is, we take each threat of this seriously. It's something we're all talking about, we're all thinking about, we're all preparing for, and our processes work tonight.
And I know you're bound by HIPAA laws, but are you able to tell us if that patient will be staying here or if that patient will be released?
Again, as you said, we're bound by HIPAA laws to protect the patient's privacy.
All right, thank you very much. And you all are holding a news conference tomorrow morning at 10, is that correct?
10 a.m.
And what will be discussed there?
We'll go over some more things that happened tonight. We'll have some of our healthcare professionals and our administrative staff there to answer any other questions you might have.
All right, thank you very much. Jen Ekman with University of South Alabama Medical Center, again confirming for us that the patient that was brought here just before 7 this evening did not meet the standards set by the Centers for Disease Control and Prevention to in fact have the Ebola virus. That was the indication we heard early on, and that is from the Mobile County Health Department. That is the first location where this patient initially showed up, and we talked to Dr. Bernie Eishold about some of the reasons why he thought there was a low likelihood that this person would have Ebola. Here's his response to those questions earlier this evening.
The concern was she didn't have a fever, so that was one of the main things that everybody is concerned about from CDC. She did not come from the endemic Ebola area, and she has no intimate contacts with somebody who had been in the area for the past 21 days. So we have I think everybody's being very, very cautious, and I'm very proud of our community and how they responded and taking care of the patient.
And her family members who have traveled to Africa, none of them have shown any
nobody else that we have, nobody else, the only family members who've been to Africa, to our understanding, have been over 45 days ago, and none of them were sick.
Again, that was actually Dr. Bert Eichel with the Mobile County Health Department talking about the reasons that initially they thought there was a low likelihood that this person would in fact come down with the Ebola virus. One of the things that they had to deal with that was sort of problematic initially in the early stages of this case was a language barrier because of where this patient, not necessarily where this patient is from, but this patient's heritage and the language that this patient speaks. Here's Dr. Eichel one more time.
Yes, we were able to, through translators, to understand the symptoms and ask specific medical questions, and then translators would respond back. And so I think that our team did a good job trying to appreciate the underlying medical condition that she had. And it was not an emergency, but it was one that we had concerns of, and our team felt that she needed to have specialty evaluation.
What is her native language?
I believe it's Swahili.
And so that is really the extent of the information that health officials would release about this patient because of HIPAA privacy laws. But the hospital will be holding a news conference here tomorrow morning at 10 a.m. to discuss what happened here tonight, to discuss how they responded to this entire situation, if there are any changes they need to make in their protocols, and see how they can even better this process should they have to use it again. But hopefully they won't have to. Greg and Kim.
All right, thanks a lot, Derek. Now, even with a low risk of